Welcome to our fascial fix for hip pain. The hips consist of the bones of the pelvis and the muscles and the fascia that support these. Sometimes the pelvis can go out of balance, and this imbalance can cause extra strain on the structures around the hips. And this is often felt as pain, which can be felt in the sides of the hips, or the lower back, or the groin, or the legs. It's often an overuse injury due to twisting sports, for example, such as golf or tennis. In this video, we share some simple self-help myofascial exercises that can help to release the restrictions that have formed and return your pelvis to better balance. In this exercise, we're going to use 2 myofascial balls to work on our gluteal muscles, so your buttocks. And I'm going to do this as a seated exercise first, so I'm going to sit on the balls. So when you do this, it's a good idea to either be sitting on the floor like me with your back against a wall to help stabilize yourself, or you can also do this seated in a chair, whichever is more comfortable for you. And so while you're sitting here, just wait for a sense of the tissues starting to release and let go. And this can take a couple of minutes before you'll start to feel some fascial release and changes in the tissues. In this area, you have the gluteal muscles themselves, which form your buttocks, and they are postural muscles. They also help with movement. So, for example, movements such as standing up, getting up from seated, and walking are all done with your gluteal muscles. And deep underneath these muscles are some deeper muscles. There's one in particular called the piriformis, which you may have heard of, and also there's the sciatic nerve. And so sometimes when these tissues become tight, the muscles become tight, then it can also cause the piriformis and the sciatic nerve to become tight and irritated. And so sometimes sciatica can be caused by tension in your gluteal muscles as opposed to being caused by a lumbar disc. So as long as you're here for at least a couple of minutes, this will be allowing time for the tissues to start to release and let go, and you may get a sense of things changing as the tissues soften and release. Sometimes people find that the seated version of this exercise is not comfortable, maybe because they have sciatica already and so there's too much pressure on the area, in which case you can also do this as a lying exercise, which I'll do next. So to do this as a lying exercise, I'm going to lie on my back and place the balls under my buttocks. Again, you can do this exercise on the floor like I'm doing, or if it's more comfortable for you, you can do this on your bed. And you're just waiting again for a sense of the tissues starting to release and let go. So this version of the exercise may be more comfortable if you have an irritated sciatic nerve or tight piriformis muscle, because there is less pressure and it's not the whole of your body weight. So while you're here, just noticing how the tissues are softening and changing. And as long as you're here for at least a couple of minutes, then it allows time for the fascia to start to release and let go. And as that releases, it allows the gluteal muscles to soften and release. And it takes the pressure off the deeper tissues such as the piriformis and the sciatic nerve. So this can help if you have lower back pain, or you have buttock pain, or indeed if you have sciatica. In this exercise, we're going to do a stretch for the front of the hips. You can do this in several different ways, and I'm going to start by doing this as a standing stretch. So if I just turn sideways on, and I'm going to go into a lunge position, making sure that my legs are wide enough apart so I have a stable base. You don't want to feel wobbly in this. Both feet are flat on the floor and my upper body is upright. Importantly, both of my hips are facing forwards. So if you imagine like you've got headlights on your hips, they should both be facing forwards, not twisted to the side. As you're here, just allow your body to sink into this stretch, and you'll start to feel the stretch here in the back leg coming up from the thigh into the front of the hip, and you may also feel this coming into your groin area on the inside of the thigh. The hip flexors are muscles that sit deep in your front of your hip. Their job is to lift your legs, so if you're walking or running, particularly if you're going uphill or upstairs, then you use your hip flexors. But for lots of people, these can get tight, and they can get overly tight, particularly if you sit a lot. So if you're driving or sitting in a desk job. This is a nice way to start to stretch out these muscles and allowing time for the tissues to start to release and let go. And the longer you do this, the more you'll feel that you can sink deeper into this stretch, which you'll feel more deeply into the front of your hip area. For the other side, we're going to do this as a kneeling stretch. For this side, I'm going to do this stretch as a kneeling stretch. And if you're doing this at home, it's a good idea to use something like a pillow or a cushion just to support your knee as you are in the stretch. So as I go into this stretch, I'm going to just lean forwards. But I'm keeping my upper body upright, and this just allows me to feel a stretch coming into the front of my hip, up through my thigh, and this will just allow this area to start to stretch out. So this may be more comfortable for you than doing it as a standing stretch. And you can experiment with just leaning more into the stretch, which is just dropping your weight forwards, or maybe coming out of it a bit, making sure that it feels comfortable as a stretch, and allowing time for the tissues to start to release and let go. This area can get very tight, as I've said. Lots of people spend an awful lot of time sitting, whether it's at work, driving, or at home in the evening, sitting on the sofa. And this makes your hip flexors very tight. And so sometimes this can contribute to groin pain or even to lower back pain. So by stretching this area out, you're helping to improve the mobility and the flexibility of your hips and taking some of the pressures off the structures around this area. So just allowing time for things to release. And as long as you're in this stretch for at least a couple of minutes, then the tissues will be starting to release and let go. Another way to do this stretch is by using a table such as this massage table or your bed. And I actually find that this is the easiest way to do this stretch. So I'm going to lie down. And then I'm going to drop my leg off the side of the table. So all you need to do is allow your leg to hang heavy, and you'll start to feel a stretch coming up into the front of your hip and into your groin area. If you're doing this on your bed at home, then just make sure that your leg is heavy. So if you have a low bed and your foot is touching the floor, that's fine. You just need to make sure that your leg becomes heavy so you feel the stretch. If on the other hand you have a higher bed and your leg is dangling, if that's comfortable for you, that's fine. If it's not, you can always put a small stool or a pillow underneath your foot to support your leg. And as long as you're here for a couple of minutes, then this will be starting to stretch the tissues in the front of your hip. In this exercise, I'm going to do a spine twist. To do this, I'm going to lie on my back with my knees bent. So when I'm here, I'm now going to drop my knees over to the right and allow things to start to relax. Now, if you're like me and you find that your knees don't touch when you're in this position, you can put a pillow in between them, and that just helps to support your legs and your hips and means that you can allow things to release and relax. The spine twist is a really nice exercise to do to open out your hips and all the way through into your back. It's important to keep both shoulders on the ground when you do this, so the actual twist is coming in your lower back and in your hip. And by doing this, this can start to release some of the restrictions that may have formed, particularly around the side of your hip. And these can be contributing to lower back pain and hip pain, even leg pain. So as you're here, you're just allowing things to start to release and relax. And you may feel sensations that may be in the area around the side of your hip, or even coming up into your back or down into your leg. So whatever you're feeling, that's fine, that's okay for you. And if you want to create a slightly deeper stretch, you can straighten your top leg out. And this will stretch more into the side of your hip in particular. So this is a great exercise to do if you have lower back pain, if you have knee or hip pain. And it can really help to release round into your back as well. So I can feel this coming up into my mid back, and sometimes people feel it coming up into their shoulders. And so as long as you're here for at least a couple of minutes, then it's allowing time for the tissues to start to release and let go. And then we can do the exercise on the other side. Coming back to the midpoint and then dropping your knees to the other side. Again, my knees don't touch, so I'm going to bring the pillow over again and place that between my knees. Again, this is just allowing my body to start to relax and release, and starting to feel a stretch coming into this side of my hip. If you're comfortable doing this exercise on the floor, that's great, but you can also do this on your bed if that's more comfortable for you. And again, if you want to create a deeper stretch, then you can straighten your top leg out and just allow it to drop down. And so the weight of your leg is now creating a deeper stretch coming round the side of the hip. You may feel it more in your hip, in your back, in your leg. Wherever you're feeling it, that's fine. That's your release pattern. And you're just waiting for a sense of the tissues starting to release and let go. So really good for helping to loosen your lower back and mobilize the tissues here, and for starting to release around the sides of your hips as well. So just being here for at least a couple of minutes allows time for the tissues to start to release and let go.